The conventional way to talk about our mental health is to use terms such as mental illness. Most psychiatrists and other mental health professionals use diagnoses such as major depressive disorder or schizophrenia or personality disorder to try to make sense of their clients' problems, to plan treatment and to think about possible causes. But some mental health professionals have started to recommend other ways of thinking about and describing these kinds of problems. One example of these alternative recommendations was recently published in the journal Lancet Psychiatry. The paper suggested that we should describe our mental health problems in simple, straightforward terms that represent the experiences themselves, not the illnesses or disorders. This means that mental health professionals could describe and record problems using official codes from our diagnostic manuals, such as the World Health Organization's ICD-11, without having to give a diagnosis. They could use these codes to capture a range of different experiences that someone may be having. For example, difficulty concentrating, or hopelessness, recurrent thoughts about death or suicide, poor sleep, tiredness, hearing voices, or believing things that other people find strange. Although offering a diagnosis would remain possible, a clinician could instead record one or more adverse or traumatic experiences and subsequent specific mental health difficulties. Here is an example of the difference between the two approaches. In the current diagnostic system, moderate personality disorder with a statistical code of 6D10.1. Possible alternative could, for example, be a personal history of sexual abuse, which has an official code of QE82.1, a history of spouse or partner violence, QE51.1, and low income, QD51, leading, understandably, to anger, MB24.1, depressed mood, MB24.5, feelings of guilt, MB24.B, and non-suicidal self-injury, MB23.E. A system based on these experiences, and not diagnoses, could avoid labelling people with illnesses, but also help professionals communicate more clearly, understand the nature of the problems better, and, ultimately, lead to better care.